This presentation will discuss the information system implementation within emergency departments in Robert Wood Johnson Barnabas Healthcare System. The need for an information system within emergency departments is very high. As of 2017, each year, 139 million emergency room visits were done. Out of those 139 million, 14.5 million admissions were admitted directly to the hospital. Per the Center for Disease Control, the number of ED visits in the United States continues to increase faster than the rate of population growth. The benefits of having an information system within Robert Wood Johnson emergency departments is very high. An information system within the emergency department can provide patients with tracking information, clinical documentation, order management, reimbursement information, risk management or clinical decision support, data management, and discharge planning while integrating the information system wide for future use. The main goal of this implementation is to improve clinical practice while supporting administrative and managerial aspects of the delivery of care that play a part in decision-making, evaluation, training, and planning. The overall goal is to improve quality of care, improve collaboration throughout the system between providers, lower healthcare costs, and provide data tracking. Risk is not a single factor or event, but rather is a combination of factors and events that, if they occur, may have an adverse impact on the organization. Some of those risks during our assessment are unauthorized disclosure of personal health information, unintentional errors or human errors, any IT issue or any problem that can disrupt everyday workflow. Using the system development lifecycle to plan the implementation for information systems in the emergency department is crucial. This process is typically used when planning, selecting, implementing, and evaluating a healthcare information system. Robert Wood Johnson, Barnabas Health, first step would be planning and analysis phase of the cycle to examine the current system being utilized and any problems that may hinder the implementation of the program. The second phase is the design phase, where the decision of using either an outside vendor or designing the program in-house will be made. In the phase, cost analysis will be observed and all alternatives will be considered for each scenario to help choose the right one for the organization. In the third phase, the implementation phase, Robert Wood Johnson will create the workflow, train their employees, ensure all system errors are addressed, all bugs in the programs are fixed, and that everyone is ready for the go-live date. Finally, in the fourth phase of the system development lifecycle, support and evaluation phase, where changes will be made after the go-live that need to be made, such as increased staffing if needed, glitch fixes, and any other obstacles that may come after go-live that can hinder the success of the information system. The success of providing care depends on collaboration, empathy, and shared decision-making. What is needed for this is a newly defined cooperation between patients and their caregivers. The impact of technology is enormous. The Institute for Healthcare Improvement states that the implementation means permanent change within the organization and building this change into the new culture of the organization. Improve decision-making process by data collection. It can help improve patient care with collaboration with hospitals and physicians throughout the system. Technology can also help reduce the cost of healthcare by eliminating duplicate testing and increase provider-patient relationships using patient portals and open communication, allowing the patient to be involved in the decision-making process of their care. When implementing a healthcare information system within emergency departments, an implementation team needs to be established. These are the key stakeholders. This team will plan, coordinate, budget, and manage all aspects of the new system implementation. 3 important stakeholders that should be involved in the implementation and planning process are the CEO of the organization, along with the respective leaderships, an IT professional that has technical database and network administration expertise, and an emergency room clinical department head. The CEO's involvement in the implementation process of the healthcare information system within Robert Wood Johnson Barnabas Health Emergency Departments is imperative. It is the CEO's responsibility to put forth the organization's vision for improving quality and patient safety while ensuring the information technology department is prepared and has a strategy for achieving the desired outcomes. It is important to remember that the implementation is not an IT project. It is a project that will take cooperation from all areas of healthcare. The implementation of an emergency information system within an ED is a transformational initiative, and foundation changes to achieve mission supporting objectives require restructuring to the delivery of care. This responsibility does not just fall on the CEO of the organization, but is the responsibility of all leadership, all senior leaderships, who need to lead the change, not just support. The IT professional is important to ensure that the system can handle such a large change. The professional will represent the IT department and have the final decision-making authority and sign-off accountability before the information system goes live. They are responsible to help remove any IT obstacles that may be faced and to meet project timelines, while promoting the project internally through the system. The final stakeholder that should be involved is the clinical department head in the emergency room where the implementation will be taking place. As physicians and clinical staff are usually more reluctant to implementing information systems because it could cause a delay in care and new challenges, it is vital to ensure that patient safety and quality of care remain the #1 priority. This person should be closely involved with the administrator and IT to ensure the decision being made will have the clinical staff and patient's best interests at hand. Their participation will also help guarantee that their medical team needs will not be overlooked throughout the process. According to David Cushan, consulting and involving clinical leadership will often gain more credibility within the organization. Enterprise-wide information can help increase collaboration, can provide more informed decision-making, improve patient-provider relationships, program implementation, and pattern identification. Enterprise-wide data can help increase collaboration with other hospitals as well as other healthcare professionals. This will help emergency room doctors have a better understanding of their patient's medical history and ultimately make a more informed diagnosis. One setback to this would be if the patient is out of state or if the primary care doctor uses a different information system that does not have interchangeable data with the information system in the emergency department. Technology versus enterprise-wide information. Data governance is the process of managing the availability, usability, integrity, and security of the data in enterprise systems based on the internal data standards and policies that also control data usage. Effective data governance ensures that data is consistent and trustworthy and doesn't get misused. A well-managed data governance framework will underpin the business transformation towards operating on a digital platform at many levels within an organization. Technology includes management. For top management, this will ensure the oversight of corporate data assets, their value, and their impact in the changing business operations and market opportunities. Finance will safeguard consistent and accurate reporting. Sales and marketing will enable trustworthy insight into customer preference or behaviors. Procurement and supply chain management will fortify cost reduction and operational efficiency initiatives based on exploiting data and business ecosystem collaboration. Production will be essential in deployment automation, and legal and compliance will be the only way to meet increasing regulation requirements. Data governance means cleaner data, which means better analytics, better business decisions, better business results, better marketing positions, and better profit margins. Enterprise-wide data Information includes data integration across multiple systems, the infrastructure engineering, the infrastructure operations, and IT management. The term enterprise minimally means across a sponsor's entire organization, corporate versus department levels, but it can just as easily be cross-operational, such as multi-agency or joint level. Embodied in this concept are technical efforts such as infrastructure engineering for building, managing, and involving shared IT or infrastructure operational for administering and monitoring the performance of the IT service being provided to the enterprise, IT service management, and information system management. Efforts like IT strategy and portfolio management and IT governance enable the concept to function effectively. Of course, implementing an information system within the emergency department will have some economic impact, as there is a large upfront cost, ongoing maintenance costs, temporary disruption of workflow, paper chart converting, training staff, and installation costs. The large upfront cost of the program and temporary disruption in the workflow can cause trouble in the emergency room. Other costs could include converting the paper charts to electronic records. While these costs will have a temporary economic impact on Robert Wood Johnson organization as a whole, the long-term advantage of an information system will outweigh the momentary burden. Overall, the impact an information system within the emergency department will have on Robert Wood Johnson Barnabas Health organizations and quality improvements are high. Not only will these systems make accessing patient information such as demographics, laboratory testing, medical history, previous radiology easier to obtain, it helps reduce the number of medical errors and reduce healthcare costs. The quality of patient care will increase, which will ultimately increase patient satisfaction. Emergency departments remain a dominant source for hospital admissions. About 70% of hospital inpatient stays are processed through the emergency department. Ensuring the correct team is in place to help with the implementation and encourage staff to adjust and learn the new application will have a positive impact on the entire Robert Wood Johnson Barnabas healthcare system. It will also some questions and answers. How do you plan on tracking progress? We plan on tracking by using data collection to ensure the number of patients are not going down, sending surveys to ensure the quality of care has not been interrupted, and working with all staff to ensure the programs are working and they are able to reach their needed resources. How will you resolve issues after implementation? Our IT staff will be fully trained to handle all information system problems that may occur. They will also be able to reach out to vendors to ask questions if needed. We will have a dedicated team to work with staff who are having difficulty or may require more training or just need a little refresher to remember how to use the system. How will you make sure that patients are still receiving the best quality care? Again, by sending surveys and asking how their visit went, also using the data to see more patients being discharged than admitting, less duplicate orders, and a decrease in medical errors.